you doing?
You're doing all right.
My name's Hannah. I'm a PA student from Methodist University. I'm just going to be doing your exam with you today. Could you just confirm your full name and date of birth for me?
Yep, it's Keith Cooper, 10/8/97.
Okay, perfect. All right, I'm just going to wash my hands, Mr. Cooper. How's your day going?
Pretty good, except for pain.
Oh no, where's that pain at?
It's in the top of my hip.
Okay. All right, so just before we get started, I'm just going to ask you, with the more focused exam, I'm just going to ask you some really basic questions and some more detailed questions about what's going on with you today, okay?
Okay.
All right, and so just to start off, is this pain just at the top of your hip?
Yes.
Okay, and about when did it start?
A few weeks ago, it was only occurring during activity, and then more recently, it's been lasting outside of activity.
Okay. Okay. And what does it feel like? Is it like a burning pain? Is it a sharp pain, a dull pain?
It's kind of like a dull pain in the top of my hip.
Okay. And does it radiate anywhere? I know, like, you said you run, right?
Yes.
So when you're running, do you feel it anywhere else?
Yes, I feel it in my knee when I'm running.
Oh, so you have knee pain when you're running too? Okay. Okay. And, do you have any like other associated symptoms? Like, do you have any like loss of sensation in your left leg at all?
I do not.
Can you feel? Okay. Do you have any like muscle weakness more on that side than your other leg?
I wouldn't say so.
Do you notice like that you favor your left leg over your right leg?
I favor my right leg over my left leg a little bit.
Okay. So a little bit of a limp.
A little bit.
Okay. We'll look at that in a minute too. And so does anything make it better or worse?
Ibuprofen helps.
Okay. And does anything make it worse, like other than running?
When I do my box jumps.
Okay. So you do like some other like training as well outside of running?
Occasionally.
Okay. So now I'm just gonna go over like a brief like family history and some of your past medical history just to make sure there's nothing associated there. So just to start off with your medical history, do you have any history of like high blood pressure, of like congestive heart failure, any like history of strokes, any history of like any other serious medical problems?
Just borderline high blood pressure.
Okay. And so do you take any medications?
Take 50 milligrams of losartan one time a day.
Okay. And is that the only medication you take for anything?
Yes.
Do you take any supplements or anything like that?
Nope, other than the Tylenol or ibuprofen for my hip.
Okay. And so your family history, does any of your mom, dad, brothers, sisters, any of them have like congestive heart failure? Any of them have cancer, any type of cancer, any like issues with their lungs or anything like that?
Nope, pretty healthy.
Okay. And so you're just moving on to, it's called a social history. So do you have any, sorry, I don't know where I was going with that. Do you drink alcohol?
Occasionally.
Okay. And how many drinks would you say you have a week?
4 to 6.
Okay. And do you use nicotine products?
Nope. You
don't smoke, no chewing tobacco?
Nope.
Okay. And do you use any recreational drugs at all?
Nope.
Okay. And what do you do for work?
I work in a lab.
Okay. And so would you say you sit down most of the day?
Yes, pretty much all the time.
Okay. Sounds awesome. So, okay. So I'm just going to ask you a few questions about your general health. Would you say that you're feeling pretty well today other than that hip pain?
I'd say so.
Okay. And have you had any have you had any recent issues of like loss of hearing?
Nope.
Any loss of vision?
Nope.
Loss of smell?
Nope.
Any issues with your taste sensation?
Nope.
Any noticeable like drooping in your face at all?
Nope.
Have you had any problems like eating or swallowing or anything like that?
Nope.
Have you noticed any like enlarged lymph nodes or areas like that?
Not that I can tell.
Okay. And other than your high blood pressure, you don't have any cardiac issues?
Nope.
Okay. And have you had any issues with like shortness of breath, like hard time breathing?
Nope.
Okay. And have you had any issues using the bathroom, either urinating or defecating?
I have not.
And would you say that your bowel movements are pretty normal?
Yes.
Okay. And have you had any abnormal bruising or bleeding?
No, not really.
Okay. So other than that, like no major issues, nothing really going on with you except for that hip pain.
Correct.
Okay. All right, sounds good. So we're gonna move into more of like the physical exam. Normally I would do listen to heart and lung sounds, but I won't just for the purpose of timing of this video. So initially I'm just observing you just to make sure that you look to be in general, well, like good health, no signs of like nutritional issues, no signs of any bumps, lumps, rashes, or lesions anywhere on you, making sure that you look pretty symmetrical. And I'm just gonna make sure, can I borrow your hands from you? Right. Capillary refill looks good. And could you just open your mouth, lift your tongue over for your mouth for me? Perfect, no signs of oral mucosal cyanosis. So now I'm just gonna move into a part of the exam where I'm just trying to figure out where that hip pain's coming from. So I'm gonna have you hop off the table for me. And first I'm just observing. I would make sure that your stance is pretty symmetrical. Could you just turn around for me, please, Mr. Cooper? And making sure that I don't see any signs of like valgus or varus, making sure that your stance is pretty normal. And so I'm gonna move this chair out of our way. Could you just turn around and walk to me? Okay, and turn around and walk back to the table. Okay. All right, and so I'm gonna have you rest your hand on this chair for me, and we're gonna do some exercises with your hip. Actually, I feel like you're gonna hit the table, so we'll step forward just a little bit. Okay, so starting with your left leg, I'm gonna have you kick it back as far as you can. Any pain with that?
A little bit.
Okay, and then kick it forward as far as you can. Any pain?
Yes.
Okay, and then kick it out to your side like that. Pain?
Yes.
Okay, and then bring it in as far as you can. Pain with that?
Oh yeah.
Okay, and then same on the other leg, kick it back. Kick it forward, and then kick it out. Sorry. And kick it in. Any pain with any of those?
Nope.
Okay. Perfect. You can go ahead and have a seat for me. Alright, so I'm actually going to have you lay down for just a second. We're going to be like kind of back and forth a little bit during the exam, so if you ever like get tired and need a break, just let me know. So first, when we're doing a hip exam, like I would prefer to have the patient in a gown, but that's not optimal in this situation, so I would be observing to make sure that there's no signs of any effusion, no signs of any discoloration, no signs of asymmetry, which his legs look to be pretty normal. There's no like inversion or eversion that would indicate any type of like fracture or dislocation. So at this point, past the observation, I'm going to go ahead and begin palpating. So, Mr. Cooper, I'm just going to be feeling around on you a little bit. If you feel uncomfortable at all or at any time, please just let me know, okay?
Will do.
Okay. So first, I'm just palpating the iliac crest, and then moving on to the ASIS, anterior superior iliac spine. For the purposes of this video as well, we're unable to palpate the PSIS or the pubic symphysis. And then I'm just going to palpate for the greater trochanter. Perfect. And then this is your bad leg, correct?
Mm-hmm.
Or not your bad leg, your leg that you're having pain in?
Yes.
Okay. Okay, ASIS, wrong. That's the iliac crest, and ASIS. And the greater trochanter, any pain with that?
Oh yeah.
That hurts? Okay, sorry. All right. So now what I'm gonna do is I'm gonna maneuver your leg a little bit. If you have any pain, just let me know, okay?
Okay.
External rotation, internal rotation of the hip. Any pain with that?
Nope.
Okay. And then I'm gonna lift this one up as well. Pain with that?
Yeah.
Yeah?
Yep.
Okay. That's external rotation of the hip. Pain with that?
Yes.
Okay. External rotation of the hip. Okay. So now I'm gonna have you return to seated for me. Actually, hold on just a second. I'm gonna just check your knees as well because I know you said you were having pain in your knees. Pain with that?
Nope.
Pain with that?
Very slightly.
Okay. All right, then you can flip and have your legs hanging off the table for me, please. Okay.
Shelby, come.
Shelby out. Okay. So I'm gonna have you move your hips in just a little bit, about shoulder width apart, and I'm gonna put my hands between your knees, and you press in, I'm gonna press out.
Yep.
Okay, and then I'm gonna press in, you press out. So that's hip. When I press in and he presses out, that's testing his abduction. And then when I press out and he presses in, that's testing his abduction. Okay, adduction, A-D-D, adduction. I misspoke. So now I'm gonna have you lift this leg up and press down, and lift this leg up again, and I'm gonna press down. Okay, so lift this leg up, press down, and then lift it up again, and press up. Okay, and press out on the hands, pull in. Okay. I believe that I've tested all of the range of motion and motor. So now I'm just gonna move on to sensory. Does this feel the same on both sides?
Yes.
Obviously this would be done without pants, but our subject today has pants on, but same on both sides?
Yes.
Same on both sides?
Yes.
Same on both sides?
Yes.
Same on both sides?
Mhm.
And then same on both sides?
Yep.
Okay. Now I'm going to check just to make sure. Would it be okay if I removed your socks?
Yes.
Come all the way down. Okay. Yeah, I'm just gonna take it off and leave it off.
Yeah.
Okay. Just feeling for the dorsalis pedis pulse.
Come.
Looks good. Sensory, circulation, motor. I'm sorry, sir. Okay. After that, I think that we're going to move into doing a couple of special tests, just to verify if what I believe to be the issue is the issue.
Okay.
Sorry, you have to remove all of those clothing items. Just making sure that you got circulation down there is important.
Right, what do you need?
Okay, so I'm gonna have you to lay down on your back for me first. And then this is your affected leg. So I think I have you in the wrong position. This is your, how did I have you lost? Okay, because this leg needs to be up, and I need to be, so you need to rotate. I'm very sorry about that. That's my fault. Okay, so scoot back to me just a little bit. Thank you for helping me with that, sir. It's been a long day. Okay, all right, so I'm gonna lift this leg up, and then just let me hold it. Okay, and so when I let go of your knee, I don't want you to hold it up. I want you to just drop it. So let me have it. Okay. Let go. And drop it. Okay, all right, you can let it down. All right, and go ahead. You're pretty far back on the table, so scooch a little bit towards the middle of the table and a little bit more. And then I'm gonna have you come back. I just don't want you to fall off of the table. So come onto your back, make sure you feel where you're at. Okay, so I'm just gonna do a few more things. Any pain with this?
Nope.
Doing the hip flexion test. Any pain with that?
A little bit.
A little bit, okay. So another thing I'm gonna do, I know that you haven't had any issues with your Well, I don't know that. I haven't asked you that. Have you had any issues when you're running or training of planting your leg and any like hearing any pops coming from your knee or anything like that?
Not really.
Okay. I'm just gonna do a couple tests just to make sure that it's not that either. So go ahead and bend your knee for me and set it down. I'm gonna sit on your foot. I know I look heavy, but it's gonna be fine. And just do some tests just to make sure it's not a ligament problem. Okay. You can let your leg down, and you can go ahead and sit up for me. Okay. So. I have an idea of what I think is going on. I believe that you're experiencing just some IT band tightness, but I'm going to grab my preceptor and just run it by him or her just to make sure that they agree with that. I don't know if I would actually share that at this point or just say, like, I'm going to leave and go grab my preceptor. So I'm just including to him what I think it might be. And so do you have any questions for me?
Nope.
Okay, sounds good. I will go grab him or her, and we will be back in to discuss the results of your exam, okay?
Thank you very much.
Thank you. And then we can start.